Have you ever felt that your vision was becoming blurry and dark, and you almost fainted or actually fainted? Or maybe you have felt dizziness, discouragement, sleepiness. Someone suggested you should check your blood pressure, and it was low, 80/50 or even lower. Someone might have told you, wow, I don't even know how you're standing. Well, that is the topic of today's video. Very low blood pressure. How does this condition affect your body? I will also talk about the types of low blood pressure, what causes low blood pressure, what are the possible complications, and at the end of the video, I will give 10 very effective tips if you tend to faint and want to stop doing it once and for all. But first, like the video, subscribe to the channel so you don't miss our health tips, and activate the notification bell. And share this video with your friends and family via WhatsApp. I'm sure you know some people who faint frequently and suffer from very low blood pressure. By sharing, you will be helping more people take care of their health. So share it. Tell me, do you have very low blood pressure? Have you ever fainted? Where in the world are you from? Write it down below. Let's go. When is blood pressure considered low? Low blood pressure is generally when the systolic blood pressure, the maximum, is below 90 millimeters of mercury or less than 60 millimeter Hg. For diastolic blood pressure, the minimum. Measure it at home and check how your blood pressure is. Is it good, high, or normal? So you saw that your blood pressure is low, 8/5, and you're not feeling anything. And it's true, low blood pressure for one person can be good, the person may not feel anything, but for another, they may suffer because of it. It usually depends on how quickly it developed and what caused the drop. What symptoms can you have? You may feel without energy, sleepy, weak, dizzy, or unbalanced. With a headache, some people feel a headache with high blood pressure, and others feel it when the pressure is very low. Well, understanding the human body, you may feel nauseous, dizzy, dark, or blurry vision. You may have cold sweat, that's sticky sweat. People may say that you look pale, and you may have a near faint or a faint, the syncope. Better not to feel anything, right? Can very low blood pressure be fatal? It can, as long as you are very dehydrated or bleeding or with a generalized infection, or if low blood pressure is due to an allergy or a dosage error of some medication, for example, intravenous nitroprusside. But, if you have 79/55, feel nothing. Your blood pressure has been very low all your life. You will not die because of that. Stay calm. Is it common to have low blood pressure? As most people with low blood pressure have no symptoms, it is impossible to know how many people it really affects. However, orthostatic hypotension, which is a type of low blood pressure, is more common as you age. At 50 years old, 5% of people have orthostatic hypotension, and at 70 years old, more than 30% suffer from it. How can your body prevent your pressure from dropping too much? Your body automatically controls your pressure and in the vast majority of times, manages to prevent it from dropping too much. Our body has baroreceptors, which are a type of pressure sensors located in the carotid sinus, and the aortic arch. They transmit information about the pressure to your brain, and they will detect if your pressure starts to drop. Immediately your body will try to compensate for that. How? By accelerating your heart rate, it will make you tachycardic and also contracting the blood vessels. So if you feel those symptoms of low blood pressure, your body is not managing to compensate for that drop in blood pressure. Rapid drops in pressure can mean that certain parts of your body, especially the brain, are not receiving adequate blood flow. And that's where you can faint. What are the types of low blood pressure? We have one, orthostatic hypotension or postural hypotension. I'm sure you've already felt this. It's when you get up quickly from the chair and feel dizzy, or you get up quickly from the bed and feel dizzy, or see stars. Has it happened to you? It can be due to dehydration, when you spend a lot of time lying down, pregnancy, some medications like those for the prostate, and as I mentioned, it is common in older adults. Other health problems that affect the autonomic nervous system, such as Parkinson's disease and diabetes, can worsen orthostatic hypotension. 30% of people with diabetes experience orthostatic hypotension. Postprandial hypotension, it is a drop in pressure 1 or 2 hours after eating. It is also more common in the elderly and people with autonomic dysfunction, such as Parkinson's and diabetes. If you feel this, try eating fewer carbohydrates or lighter meals, avoid alcohol, and drink more water after eating.
Neurally mediated hypotension occurs when there is an abnormal interaction between the heart and the brain. Have you seen those soldiers who faint because they stand for a long time without moving? It always happens to the Queen's soldiers. Children have this form of hypotension more often than adults, having a strong emotional response, such as when drawing blood, you see the needle and faint, you see blood and faint, and it's not a whim, it's a reflex, like when you hit your patella, the patella reflex shock, which is the most serious cause of hypotension when the person bleeds a lot, or is extremely dehydrated, or has a severe infection, or spinal trauma during shock. Your organs do not receive the blood and oxygen they need to function properly, and this can indeed be fatal if not treated quickly. We also have other types, such as hypotension caused by medications, lack of certain hormones, like corticosteroids, and adrenal insufficiency. When to consult a doctor? If you have symptoms of low blood pressure, frequent fainting, you should see a doctor, or of course in case of shock, you should seek emergency care as soon as possible. If it is shock due to an infection, the faster the antibiotic is administered, the greater your chance of surviving septic shock. What causes low blood pressure? Various things cause low blood pressure. It can be genetic. Your whole family has low blood pressure. It can be due to your constitution. You are thin, with little muscle and fat. You are more likely to have low blood pressure. It can be due to diseases of the central nervous system, such as Parkinson's. You may have lost blood, or be very dehydrated, hypovolemia. You may be having arrhythmias. There may have been a pulmonary embolism, a heart attack. It can be due to allergic reactions. Anaphylaxis. It can be because your heart is weak. Cardiogenic shock. It can be due to a prescribed medication. Here I include medications for the prostate and for erectile dysfunction, such as Viagra, or it can be due to alcohol. Most of the time alcohol raises blood pressure, but in some people, it can lower it. Drugs, medications, supplements, vitamins, pregnancy, especially in the first or second trimester, and when it is very hot. What are the possible complications of low blood pressure? For older adults, it can lead to falls and fractures, such as in the hand, femur, and spine. And if you are taking medications for high blood pressure, and your blood pressure is now very low, it can damage your kidneys and receive little blood in your brain, making you slower or drowsy. In this case, you should also consult your doctor to reduce the dose or even stop the medication. And now, how to prevent feeling bad due to low blood pressure and how to avoid fainting if you have vasovagal syndrome. What are the 10 tips? Remembering that the last 3 are the most important, so stay until the end. Number 10, avoid alcohol. Alcohol dehydrates, can have a vasodilator effect, and can increase your risk of fainting. 9, avoid standing for a long time, especially if you are standing still and if it is very hot. All of this increases your risk of fainting. 8, do exercises, especially those that strengthen the leg muscles. The legs, especially the calves, help in the return of venous blood to the heart. 7, wear medium compression elastic stockings, especially in times of high stress when your symptoms tend to be more frequent. Compression stockings prevent blood from pooling in the legs and promote return to the heart. 6, if you feel dizzy with blurry vision, sit down or even lie down and raise your legs, and only get up when you are completely recovered. This simple gesture can prevent a fainting spell most of the time. 5, sleep well 7-9 hours a day. Little sleep increases your risk of fainting. 4, raise the head of your bed by 10-20 cm. This measure reduces crises because you will lose less fluid during the night. Number 3, avoid prolonged fasting. Try to eat every 3 hours. When you are fasting for a long time, your vagal reflex increases. Number 2, eat more salt. Of course, you should first talk to your doctor. But if you don't have high blood pressure or another pathology where it is better to avoid salt, increase your salt intake in your diet. It can be with olives, with those Japanese salted plums umeboshi. Salt retains fluid in your body, and yes, it will reduce your crises. Number 1, the most important, drink a lot of fluids. Drink 2 to 3 liters of fluids per day. It can be juice, it can be coconut water, it can be Gatorade. Drink a glass of water as soon as you wake up. And of course, keep the tank full all day. Being well hydrated greatly reduces your chance of fainting. Did you like the video? Remember to subscribe. For more informative videos health, please check my other videos on this channel. And until the next video, bye-bye.